Good morning and welcome to UBLUR TV. I'm your host, Brad Harmon, and today my guest is Dr. Trey Rigert with Columbia Pain Management in Hood River, Oregon. Good morning, Dr. Rigert. Welcome to the broadcast.
It's great to be here, Brad. Thanks.
We're glad you could make time to join us. Now, Dr. Rigert, we've talked about pain, chronic pain and pain management and pain medication, a lot of different subjects over the last several months. I was recently talking with a friend of mine who is taking some pain medication called Tramadol, and he's a little concerned because he understands that there's some changes coming in that medicine, or at least in how it's regulated. Can you tell us what those changes are and how they're going to affect people that are on Tramadol?
Yeah, another great question, Brad. You know, Tramadol's been around since about 1995. I'd been in practice about 5 years when it was first released. And I remember when they released it, they came out and said, here is a great new pain medication, and it's not a controlled substance. So you'll be able to prescribe this to people without having to worry about problems of addiction and the DEA and the regulation. Well, guess what, Brad? 20 years later, they've changed their mind, and they're going to make Tramadol a scheduled medication. The DEA has decided to make it a Schedule 4, which means it will be regulated just like Valium. It's in recognition of the fact that you can get addicted to Tramadol. That's what this is about, that it can be abused, that it can be sold on the street. What that means for our patients that have been taking Tramadol, if they have 5 refills on their prescription, there's some possibility that the pharmacy may not refill it again after August 18th. That's the official date that this will be a scheduled medicine, Schedule 4. There's also some possibility that people may want to come off the medicine. The other thing I'll point out in today's video, there is a withdrawal syndrome or an abstinence syndrome associated with Tramadol. So if you do, after listening to this video or Googling Tramadol, decide to come off, don't just stop it. You need to take a little bit less every few days and taper yourself off, or you will not feel well. So the message today is that Tramadol is being scheduled as of August 18th as a Schedule 4 medicine, and you would want to taper off of the medicine, not abruptly stop it. And if you're planning to continue with the medicine, it's probably a good time now to contact your pharmacist in your doctor's office to make sure that you'll have the medicine available after August 18th, because you don't want to run out abruptly.
That sounds like good advice. So they're making this change in response to the fact that people are misusing Tramadol? Is that like they're misusing oxycodone?
Yeah, it's not as potent an opiate as oxycodone, but it does have opioid-like effects. It also affects pain the same way that Cymbalta does. It's a norepinephrine and serotonin inhibitor, so it's actually a very good pain medicine. But because of the opioid effects, some people, depending on their genes, can get high from it, and they will take too much. And we have seen people become addicted, and we have had to send people into rehab for Tramadol. So it's not very frequent. It's pretty rare. But there are some potential problems after 20 years, we've decided, with Tramadol.
Okay. So the big news is that if you're using Tramadol like my associate is, you need to check with your physician to make sure that it's still going to be available for you after August 18th, because the regulations are changing on how it's distributed.
Yeah, and I'd start by talking to your pharmacist, because it's still been unclear to us whether pharmacies will honor renewals. Right, because a lot of physicians have written for Tramadol with 5 renewals, and it's unclear what the pharmacy is going to do with those 3 remaining renewals after August. So I'd start with a call to your pharmacy, and if you find out they're going to be canceling your renewals, then you ought to be talking to your physician.
That sounds like great advice. Well, we appreciate that, and maybe we'll talk some more about this subject as we go forward.
Yeah. Thanks, Brad.
Thank you, Dr. Rigert, for joining us, and thank you for joining us on UBLUR TV. We hope that we'll see you again soon on another broadcast.